everyone. I'm going to be talking about my client JJ today. JJ is a 4-month-old boy who is attending pre-K for the first time, never been in daycare before. He's an only child that lives with his mom and dad. And what first came to their attention that there might be a need for some speech therapy was that his teacher noticed in school that JJ was was a little bit behind some of his peers in phonological awareness, alphabetic awareness, and also his expressive and receptive language. The teacher, for example, would ask a question and JJ would not answer the question at all, or would just answer with something kind of completely unrelated. So the first step was he went to his pediatrician to do a hearing test just to ensure that it was nothing hearing related that was not allowing him to respond or he has kind of a limited vocabulary, and making sure that wasn't anything due to his hearing. And his hearing test was completely normal, but while at that appointment, he was diagnosed with ADD. And then it was recommended that he see a speech language pathologist to help with all of those things that I mentioned that his teacher mentioned, noticing in class. And then after that, being the first time in school, parents didn't really know exactly what to look for, but they were then like, oh, that totally makes sense with what we're seeing at home too, as well as the hyperactivity and inability to kind of focus for a very long time. So after doing the initial evaluation and some testing on JJ, and then also while speaking with his caregivers and doing like a really extensive case history, also reviewing the relevant medical records with that ADHD diagnosis and anything else that would be important to know, and then collaborating with his teacher as well. This baseline session is what I'm going to talk about today. And I chose the milieu teaching approach to use with JJ. The reason I chose that was because it is a naturalistic and play-based kind of approach. It's really easy to adapt across all environments, so it can be used at home, at school. JJ has a developmental language disorder, which this is a perfect approach to. It's been evidence based practice, backed up by that with lots of research. This is a great approach for language, receptive language and expressive language, which is what I chose to target first for JJ, so that he has that foundation of skills, making sure he can really comprehend and then respond before we further on work on the phonological awareness and alphabetic awareness. Another approach I considered was the emergent literacy approach, which would also target a lot of things that JJ needed, but he is getting a lot of the things that are involved in that approach already in school and at home, because his parents are very involved in doing a lot of developmentally appropriate reading and literacy things as well as at school. So I felt like he wasn't missing out on that portion, but this for speech target would really get him motivated to want to come, because I can include movement, I can include different activities that would really be enticing to him, and would also allow me to really assess those expressive and receptive language abilities that I'm targeting first. So during this session, what I did is broke it up into 3 activities. We only have 30 minutes and he doesn't have a long attention span. So I wanted to kind of sandwich the interactive reading, joint reading activity, because I do want to include that, but I wanted to sandwich it in between 2 more play-based activities. So start off with like a ball throwing movement activity that also incorporates part of the speech goal, and then move on to a reading activity. I have a bunch of dinosaur books here. That was an interest of JJ's. And then lastly, doing a sensory activity where he can find the dinosaurs in like sand, rice, dry beans, and like a sensory bin. So the reason I did 3 different activities was to keep him motivated. I wanted to get him warmed up to come in with a movement activity, and I can also utilize the 4 techniques in the milieu teaching approach, which are modeling, manned model, incidental teaching, and time delay. And each of those really targets very well what JJ needs and will prompt him to be able to work on some of those expressive and receptive language skills. And since I don't have long to talk about it, I will just share that the goal. So during the baseline session, JJ was about what I wanted to target was answering those what, where, when, why, how questions. And he was at about 23% during the activities after taking some data. And so the goal I set for him is a year out, April 13th, 2026, when engaging in a joint reading or play-based activity, JJ will answer WH questions about related content when provided minimal cues with 60% accuracy or greater. So I felt like that was a good reasonable target just based on kind of his lower baseline, and then that I'm seeing him for 30 minutes a week, and then allowing some cues to still be in there, and that or greater leaves a chance for him to surpass this goal, but it makes it reasonable and attainable. So I think I'm probably out of time. Thank you so much for listening.